the session, just tell you that this session is being recorded, as you can just see. If you don't feel comfortable with that, please turn your video off. And I would like to start by acknowledging the traditional custodians of the land in which we're meeting today and pay our respects to elders past and present. I acknowledge the sorrow of the stolen generation and the impacts of colonisation on Aboriginal and Torres Strait Islander peoples. I recognise the resilience, strength and pride of Aboriginal and Torres Strait Islander communities, and we did have a beautiful celebration today at North Richmond Community Health, which I know some of you were a part of, and I thank you for being there. And it is an absolute pleasure to chair this evening. My name is Laura O'Shea. I manage the High Risk Accommodation Response Project. I know pretty much all of you. I even know you, Faiza, and thank you for joining us. And we have 3 guest speakers tonight who I'd like to just briefly introduce to you before handing over to them. We will, the sort of proceedings will be for them all to present. Imogen's going to kick things off, and then we'll have space and time for questions. Okay. So Imogen Jordan, if you just raise your hand, Imogen, or say hello, is a registered nurse who was trained in the UK with a background in aesthetic recovery and critical care nursing. Imogen has been working in the Hurrah team for 6 months in our outbreak response, which has been fairly significant, and is now leading the complex vaccine engagement project. This project seeks to connect on potentially a one-on-one type basis with people that might have questions or feel unsure about the vaccines for their children or for themselves. And we do know that, we're very focused at the moment at North Richmond Community Health on the booster program, and also supporting families to consider vaccinating their children aged 5 and above. Imogen can be, accept a direct referral, and we'll put some information on the chat about that. Dr. Elise is a paediatric doctor who's currently working at the Royal Children's Hospital and North Richmond Community Health Centre. Her experience is mostly in the acute hospital setting, looking after children with common medical conditions like asthma, viral illnesses, including COVID-19, and premature babies. Elise has a strong interest in child development and behaviour and is doing specialist training in this area, and will sort of potentially touch on her experiences of caring for COVID positive mothers and babies in the NICU. Faiza Mahat, that is an enrolled nurse who has lived and worked in community. Faiza brings a breadth of local experience and has played a critical role in our outbreak response for Hurrah and for community. Faiza continues to work in our clinical team for Hurrah and is also working on a project with the Centre for Culture, Ethnicity and Health to address vaccine hesitancy in families from East Africa, as well as some broader health issues and questions they may have. Faiza has 4 beautiful children who were recently vaccinated at North Richmond Community Health Centre. So without further ado, I'm going to hand you over to Imogen Jordan, who is going to provide some information about children's vaccinations. Thanks, Imogen.
Hi there, it's Imogen.
Just hold for a second.
Hi, sorry about that. So I'm going to introduce the session. So I'm going to just do a presentation which is about the COVID-19 vaccination for children 5 to 11 years. So we're offering it at North Richmond Community Health Centre. The one vaccine that we are giving is the Pfizer vaccine. It's the only COVID-19 vaccine currently approved for use in Australia for children 5 to 11 years. So what we know about the vaccine and why we need it to stay safe. Getting vaccinated protects you and your community. It's recommended that children from 5 years old and over should be vaccinated against COVID-19. We know it protects children particularly from getting long COVID, as well as getting sick with COVID, the COVID virus itself, so preventing them from getting severe symptoms, but then also preventing them from having extended periods of having these symptoms, because we know children can also get long COVID. So what is long COVID? Long COVID is the name given to the symptoms some people experience for weeks or months after the initial COVID-19 infection. What do these symptoms look like? They're a cluster of symptoms, and the most common ones are shortness of breath, cough, fatigue, difficulty concentrating, changes in mood, and palpitations, so like heart pounding and skin rashes, and muscle fatigue and joint pain. So there's lots and lots of symptoms that can come under COVID or long COVID, and it's very unpleasant for children to have this after COVID-19, because it really impacts on their way of life and their ability to go about their daily activities. So if you have ongoing symptoms and you're concerned about long COVID, they need to be checked out by their regular doctor or their general practitioner, so they can answer any of your questions and have checkups by the doctors and have referrals to specialists as well. So most people make a full recovery to long COVID, but it's important that you seek help if you find that your symptoms are not, that your child's symptoms are not improving, and that you can discuss that with your doctor. Okay. So I'm just going to show this video if possible. Let me see whether it will work. And this is about children with long COVID.
Take your time, Imogen. And if not, we can always send it around afterwards, because it might be difficult to lift off.
Yeah, I might not be able to show it, but it's a really useful information video about children in the UK who have not had their COVID vaccination because it wasn't available to them, but they got COVID, and it's just about how they are living with long COVID. So it's a really good watch to understand how children are impacted by long COVID. So I'll send it or make it available to you afterwards. Okay.
Thanks, Imogen. We might even be able to find it to pop in the chat after you finish your presentation.
That sounds
Thank
great.
you.
And what's the difference in the children's vaccine? So the children's vaccine is made of the same ingredients as the adult's Pfizer vaccine. It's a quarter of the dose of the adult vaccine, so it's just a smaller amount for smaller bodies. And what does the vaccine actually do? Vaccines lessen the risk of contracting COVID-19. They cannot cause COVID-19. It's not a live vaccine and does not contain any part of the COVID-19 virus. They do not completely stop people from catching COVID-19. However, they do prevent severe infection. So if your child catches COVID-19 after getting vaccinated, they are less likely to need to go to hospital. And getting vaccinated helps us all to get back to living a normal life, keeping schools open and allowing your children to get back to all their normal activities. So the side effects, so I'll just run over some of the side effects from the COVID-19 vaccination. So the common side effects are injection site pain or swelling, tiredness, headache, muscle or joint pain, fever and chills. It's common for these symptoms to last 1 to 3 days. They normally don't last longer than that, and it would be uncommon for your child to get any of the more severe side effects, such as diarrhea, vomiting, joint pain, lymph node swelling, hypersensitivity or decreased appetite, nausea, and a severe allergic reaction. But with all vaccination clinics, there's always registered nurses giving the vaccination, and there's always a doctor or medical support on site. So if they were to have a severe allergic reaction, it would always be supported by a medical team. And if you were to be worried about your child or the side effects that they're having after the vaccination, you should always contact your doctor. So the risk of heart inflammation, that it's important to understand the risk of heart inflammation. However, it's a rare side effect of the vaccine. We know that in adults it is a little bit higher, but in children it's a lot lower, and the symptoms normally appear in 1 to 5 days of the vaccination. The most common symptoms are chest pain, pressure and discomfort in the chest, irregular heartbeat, so when it's like fluttering in the heart, and fainting, shortness of breath, and pain when breathing. But as I said, the majority of these cases have been in men in their 30s or 30s and under, so it's mainly in young men, and we know that it's a very rare side effect in children. So understanding the risk, there is less risk of heart inflammation in children under 12, as I said, compared to 12 plus. 8 million doses have been administered to the age group of 5 to 11-year-olds overseas, and only 4.3 per million cases in males have happened, and 2 per million cases in females have had this side effect. So both are treatable. It's a treatable condition. If someone's to get heart inflammation, this is called myocarditis and pericarditis, and it's treatable, and no one has died from it. And it's very rare, and it can be treated, and it can be treated by contacting your GP, so they'll help take you to hospital, or calling 000. Getting your children vaccinated at North Richmond Community Health Centre. So we offer the Faiza vaccine at North Richmond Community Health Centre, and they need to have consent from their parents, and so they need a written consent form, but then also for their parent to attend the appointment too. So understanding your child's concerns. So when you're discussing your child getting vaccinated, always assume your child has questions. Ask them, what do you want to know about the vaccine, and answer all the questions that they have, and then make time to listen, so you can they can share all their concerns with you before you answer any of their questions. It's important to reassure them. We all know vaccines have side effects, and so helping them know what to expect and how to manage any side effects, and how any side effects will be managed, is important. Acknowledge that it's normal to have questions, and that you had questions when you had your vaccine too, and share your story about it, because we all know sharing our own personal experiences and our own personal stories are really important when it comes to healthcare and the vaccination. Okay. So understanding your child's fear. Needle phobia and needle distress is a very common in children. However, there are a number of things we can do as parents and as healthcare professionals to reduce this fear, such as immunization plans in place to manage a child's fear in the vaccination clinic. We would do, if your child is known to be needle phobic or have a phobia of needles and have severe needle distress, we can organise a plan and have something in place to manage the fear. So if you just ring the vaccination clinic, they will provide advice. It's a good idea as a parent to discuss with your child what will happen when they get vaccinated, to manage their expectations, so they understand what's going to be going on the day. And then having distraction techniques such as stickers, toys and bubbles are always helpful. Take a cuddly toy so that they can squeeze it when they sit on your knee, and also having them like cuddled close to you, so they're not they're like comforted by you being there with them, and they're able to squeeze your hand. So pain management, there are also a few techniques that we can use as healthcare professionals, such as localized pain relief cream and buzzy bees, which are a small device that goes on the child's arm and it just buzzes, and it's normally cold, so it takes away the sensation of the needle going in on their arm. Okay. So some children will be anxious on the day, and that's okay. We're prepared for that as healthcare professionals. It's normal for children to feel anxious and worried at the thought of having a vaccination. So having a plan on the day and deciding what distractions techniques or soothing activities you might have for your child to support them, and then trying not to say it won't hurt at all, but rather say it will be brave and it will be over soon, because we know as adults that needles do hurt. It's not painless to get a vaccination, but it is over quickly, and in the long term it benefits us. So try and explain what will happen on the day of the vaccination, but don't discuss the needle itself to avoid building up fear. So vaccinations for children are not mandatory at the moment, and the vaccine has been made quickly, so you might consider, you might think it's unsafe, but all vaccinations are tested to the highest standard and they are standard by organisations that make vaccines and medications safe to use in Australia. So they've all been tested by medication groups and vaccination approval groups, so they're safe for the use in children and adults. And the vaccine is halal. So some commonly asked questions. What if my child has a medical condition? So if your child has an underlying health condition, it's recommended that the child makes an appointment with the GP to discuss any concerns if they have any underlying health condition before they get vaccinated. But it's important for your child to still get vaccinated, because it's more likely that COVID-19 is going to make them more poorly, and they're going to have more severe side effects. So how long will my child be protected? It's not confirmed the length of protection, and there's still ongoing clinical trials as we are still living through the pandemic and through COVID-19. And to be considered fully vaccinated, your child needs to have 2 doses, and it's 8 weeks between those 2 doses. And there has not been a booster approved for children. And just a little bit about adult booster doses. So it's strongly recommended that 3 months after the 2nd dose, you get a 3rd booster shot, as vaccine protection declines after 6 months. And can I get a different vaccine to my booster dose? Yes, you can. So you can have Pfizer if you've had AstraZeneca, and if you've had Pfizer, you can have Moderna for your 3rd dose. So you can have different vaccines, and we offer booster doses of Pfizer at North Richmond Community Health Centre. So we are able to provide children's vaccinations from 4 till 7:30 p.m. on Thursdays, and adults doses on Fridays and Thursdays. But if you need any information about the vaccine, you can contact people at the White Tent, and also contact me.
you so much, Imogen. It's super helpful, and a few interesting points there. I like you touching on the buzzy bee. I've certainly personally used that for one of my daughters who's needle phobic with incredible success. It's also interesting to note the change in language that's come through ATAGI, which are the big regulators at the top, around their use of language, and they're talking about being up to date. Are you up to date rather than are you boosted or have your children had? So, you know, a child that's had 2 vaccinations would be considered to be up to date at the moment. An adult at the moment that's had 3 is now considered to be up to date. So that's an interesting language shift. And I think we'll see some more changes as we move through the next stages of this pandemic, none of us knowing where it's going to end. I'd like to now introduce you to Elise DeBarco. So over to you, Elise. Thank you.
Hi, everyone. Thank you for the lovely introduction, Laura. I just basically wanted to use the time that I have tonight just to, I guess, give you a little bit of a snapshot of what other services are available. Obviously, North Richmond Community Health are doing a fabulous job, but there are a few other clinics that are running for kids who are in sort of a special high risk category. And I also just wanted to point you into, direct you towards some resources that are a little bit more, I guess, maybe culturally appropriate or in different languages so that everyone can access reliable information that meets their needs. So we'll just go to the next slide. If that's okay. I don't think I can drive the slides on this, can I? Thanks, Ali. So I just wanted to highlight for you that the Royal Children's Hospital does have a drop-in centre, and they're open Monday to Friday, 9 till 4:30, and you can just pop in at any time. You don't need an appointment, and they have a bunch of nurses and doctors there, and they can actually provide any vaccination that your child may need if they're not up to date. And they also do offer opportunities for one-on-one consultations, which obviously Imogen can do as well at North Richmond. But, you know, if you were near the Royal Children's Hospital and wanted to pop in, they can do that too. They do also help kids with needle phobia, and they can do travel vaccines. So I just thought I'd put that information up there for you to access. They also have an email as well, and so you can always contact them if you had any specific questions for them. We'll pop to the next slide. Yeah, and I think this next slide is really just for information for you to know that we do actually have a statewide reporting service for adverse events for any vaccine, including the COVID-19 vaccine. So all medical doctors are mandated to report any adverse event following immunisation to a system called SafeVic, and the health authorities here in Victoria monitor those reactions. And obviously, if there were anything to emerge as things like myocarditis, for example, have, as previously discussed, they obviously alert medical doctors so that we know to look out for various side effects. And so I just wanted to, I guess, put your minds at ease that we are actively surveilling for side effects from vaccines. It's definitely something that we're transparent about. And it's good because we have population level data to kind of get a sense of what's happening in the community with this vaccination program. The other service to note is something called the Victorian Specialist Immunisation Service. And this is a new service that children and adults can be referred to via their GP. And it's specifically for any person who's had a vaccination but had an adverse event. And they're obviously naturally quite worried about getting the second vaccination if they need it. And so the key candidates or people that they see in this clinic are anyone who's had an adverse reaction after any vaccination, COVID vaccine or otherwise, anyone who might be at risk of having a bad reaction, and that's usually kids who maybe have anaphylaxis or really bad allergies, or some kids who have quite severe epilepsy, and sometimes if they have a high fever after having a vaccination can trigger seizures, and also kids who have needle phobia. So if you have a child who you think might fit into any one of those categories, you just have a chat to your GP about getting a referral, and you can see paediatricians and adult doctors in that clinic, and they can make arrangements to safely do vaccination. And sometimes that means kids need to be admitted to hospital for a night. Sometimes they might need to have some anaesthetic to go to sleep to have their vaccination. So it's just important to know that these services are in place for kids, particularly, things thinking about kids who might have autism or developmental problems where it's just not feasible for them to be vaccinated in a community clinic or elsewhere. Next slide. Now I've just got a whole bunch of resources for you. So this is from the Australian government. They've basically got a list of over 50 fact sheets on COVID-19 vaccination in all these different languages. So I've got that resource for you there. We'll go to the next slide. And you'll be able to access these slides without any issue. I'm sure we'll find a way to distribute them. This is a web page which is also available in lots of different languages, and it's specifically just a discussion of, I guess, some mythbusters, because obviously people have a variety of concerns around the vaccine, and so this is just available in different languages, so I thought I'd put that on there as well. And then I think this is a great website. You may have already seen it. It's a website from SBS, which is one of the broadcasting networks. It's actually a coronavirus portal. And if you flick to the next page, you'll see they've got all these different languages. So you basically scroll to the bottom of the web page, click on the language, and then if you flick to the next one, the entire website is then translated in the language that you need. And the information that they're providing about coronavirus on this website is evidence-based and endorsed by medical and scientific people. So I think that's a great initiative that they've done there. Now, if English is your first language and you are keen to get a little bit more information around some of the concerns that have been raised from a child health point of view, but also even women's health, I would strongly encourage you to have a look at the Melbourne Vaccine Education Centre. This is a fabulous organisation, which is really it's what's managing our statewide services for the kids who have special needs with their vaccination. But they also do lots of education for medical professionals as well. But there's also a lot of great resources for the general public and for parents. And if you just scroll across, I think I've got on the next slide. So they've got some great fact sheets. I was actually hoping to potentially share screen to show you the website and a few of the different areas, but I don't know if that will be possible. But I think that the FA...
I could make you a host if that's helpful, Elise.
Yeah, oh, that would be great. If we have time, I'm not sure if we do. But
we do. No, we do. That's good.
Yep. Yeah, there's just oh, thank you. I'll just get it up for you.
Probably another five minutes, if that's all right, Elise.
Oh, yeah, sure.
Thanks.
I was just going to show you this one here. Oh, thank you. So I'll just share the screen now. Share screen and do this one. Yeah, so basically this is the website here, that's the MVEC, and if you scroll down you can just see they've got the this is the link to the VICSIS, which is the Specialist Immunisation Service. Obviously they also monitor SafeVic, which is the adverse events, but you can go down and have a look at the sort of high risk population, so children, pregnant women, and basically have a look at some of the FAQs. I know that one that's been particularly spoken about by some people that I've had contact with was around women's health in particular. So I'll just scroll down to where the women's health one is just here. So I know there have been some concerns around pregnancy, fertility, menstruation, breastfeeding. So there's a whole bunch of fact sheets here that you can have a look at. If you had any specific concerns, they've basically got a summary of the evidence, the scientific evidence around responding to that particular concern. So I'll just stop share there. I think that is pretty much everything that I had to say from the PowerPoint.
It's fantastic, Elise, and perhaps we might be able to bring together some of those resources to send around afterwards, particularly given the group is nice and small, which has its own benefits. So thanks, Elise. We will have time for questions at the end. So I am now going to welcome Faiza. We have formally introduced you before. And so Faiza is just, I think, going to touch on her sort of personal experiences with her children, and perhaps a little bit about her roles. Thanks, Faiza.
Hi, as many of you might know me, I'm Faiza. I know most of you here. So yeah, my kids got vaccinated not long ago. You know, being a mother, you always want the best for your kids, and you know, like you don't want your kids to get sick. Also, you know, this variants and COVID it's been a very difficult time, especially, you know, homeschooling, and you know, so getting the kids vaccinated is all about getting back to normal, as we said. You know, not doing homeschooling, and protecting our mothers, grandmothers, grandfathers, obviously. And yeah, my experience when my kids got vaccinated was actually they only had a sore arm. Imogen and my other colleague Hannah gave them the vaccine. Imogen was the one that gave them. Yeah, they actually only had a sore arm for one night, and yeah, that was it actually. And yeah, that's my experience of getting my kids vaccinated. Yeah, as a mother, as I'm aware, a lot of people in the community, I have a lot of questions about the vaccine. It's been made up quickly. You know, will my kids get autism, or will they have fertility issues? And yeah, that's why we're always here for the community to answer their questions and their hesitancy around the vaccine. As I said, Imogen, me, and we're doing this project. We're going around playgroups, meeting up with youth workers, doing broadcasts and all of that. So always, if you know anyone around the community that has any questions about vaccine information or about the vaccine, come talk to us. I also myself, I speak Somali and a little bit of Amharic, and not much Arabic, but I can give it a try. And yeah, that's about me.
Thank you, Faiza, and I can hear your beautiful children in the background. Busy mother of four, and just to touch on, you know, Faiza's wealth of experience of seeing people sort of like myself and Imogen, and you know, really struggling with the effects of COVID. And I think, just to give it some context, we are ahead of the game at the moment with, you know, we're in March, you know, we've got a little bit of time to prepare for the winter season, but it's important to note that as we stand at the moment, understand the modelling shows that New South Wales is expecting 30,000 cases a day within the next 2 weeks. That will directly infiltrate to Victoria. So we have a time at the moment to really collectively respond as a community, to protect one another and sort of take this step forward while we can. I think, you know, Northumbria and Harare is very aware that things may look very, very different in a month's time. Interestingly, we've already seen a really small case rise number in the last day or two, and that sort of directly reflects a slight rise in cases locally. So I think we're uncertain of where this pandemic will lead us next. But I think that we always act in an evidence-based manner, as Elise has pointed out. It all is scientific evidence, advice. It's well considered. It's clearly proven that it's very safe and the risks are minimal. I definitely, to touch on my brief experience as a mother of 3 young children living in pandemic life, and I was able to get my daughters aged 7 and 9 vaccinated with their first dose in January. We then all had COVID, and I have a young son who's 4, and so was unable to be vaccinated. And so they had 1 vaccination under their belts as the 7 and 9-year-old, and it was quite remarkable to me to see the difference in their viral illness from their younger brother, who was unable to be vaccinated. And albeit his illness was quite short, he then had rolling fevers, sort of unusually, rolling fevers for another week afterwards, and was quite sort of lackluster and lost some weight. So that was my personal experience. It was sort of quite a clear difference between the children that had a vaccination. So I'll just hand it over to anyone that has any questions, comments, information that they would like to share in this really safe space, of course. It's totally fine not to have questions. I understand. And I think also just want to sort of acknowledge the fatigue of all of us working and living with COVID, and talking about it every single day for almost 2 years now. And so I sort of still remember that sort of March 2020, and, you know, none of us could have really anticipated the force that COVID hit us with, as a city and a state and a country and around the world. And so I, you know, thank you all for coming along. I think in the chat we will put Imogen Jordan's details down, a direct referral via email, a simple email to Imogen, or pick up the phone and give her a call. Imogen is also very happy to facilitate actually, you know, supporting walking into the clinic and actually sitting with children or sitting with you. So that's a pretty unique sort of service and time that Imogen can offer, and I'm really grateful also to Elise for sharing some of the other sort of fantastic ways that we can support children to get vaccinated. And I know some of you here are service providers, so also great to know just the sheer volume of resources and places that people can go to access information, which is also really important. So I think Imogen's just going to type that there. I will just put the call out before we conclude for any final comments or questions, noting we are ahead of time, but really grateful for those that were able to sort of create the time in their busy days and lives to attend this session.
Thanks, guys.
Thank you. We're just going to wait for Imogen to pop that info in the chat, and then we will conclude. Again, sincere thanks to all of our wonderful speakers sharing all of their knowledge, and sincere thanks to everyone that was able to attend tonight. This session, as I said, is recorded, and we will seek to share it on our social media. So watch this space. So you can see Imogen's number there, and Imogen, you're also putting your email address in.
Yes, I am.
So Imogen can be contacted via email, Imogen J, IMOGENJ @nrch.com.au.
Yeah.
Please reach out.
Yes.
And big thanks, Laura, for that kind chat comment. Thank you.
Thanks, Faiza.
Thanks, Laura Duncan, for coming.
Yes. Thanks, everyone. Thanks so much for a great night.
All around.
Thank you.
Thank you. Thanks very much.
Thanks, everyone.